A patient today asked about buprenorphine and was wondering why it was so regulated, why you have to get special licensing as a provider to write for buprenorphine, and why patients had to come in for regular drug tests when they were on buprenorphine. I thought this was a really good question. And buprenorphine, although it can be extremely effective for some individuals in terms of treating their opiate use disorder and preventing risk for relapse and overdose and death from opiates like oxycodone, heroin, fentanyl, and methadone, it actually can also enable individuals, if they're not using that medication properly or not being monitored properly. And an example that I can give you is that we've had patients in the past who would come in for this medication. They would state that they were taking it every day. And then when we had surprise drug tests, they would be positive for opiates like oxycodone and methadone, etc. And what some individuals will do with this medication, which you really as a provider want to do everything you can to prevent them from doing this, but they may wait until they're out of opiates like oxycodone or methadone or heroin or fentanyl, or wait until they're out of money to buy those things, and then using their insurance, fill a prescription for buprenorphine, and then use it for a few days to mitigate any withdrawal symptoms that they have from the illicit substances, to make it easier for them to withdraw or to detox themselves from those substances. And then as soon as they got more money, or as soon as they get access to the other drugs that are out there, they would go right back on it. And so if a provider isn't monitoring closely, often what we'll do is utilize family or friends to make sure that the person is taking it every day, and to make sure that they aren't showing signs that they've relapsed in between visits or in between toxicologies, for example. But you really want to keep an eye on this, because if someone is using that medication to make their withdrawal easier, it's actually likely making their substance use disorder worse. With all that being said, this medication, I very much believe, saves lives, and if used effectively, can be incredibly helpful for preventing relapse, for helping individuals to move forward in their lives and to change people, places, and things, and to do really well. And so if you're going to take this medication, you need to be under the direct supervision of a provider. If you believe this pertains to you in any way, please be sure to reach out to a mental health professional and schedule an appointment.